Hey everyone. Today we're going to cut right through all the noise and try to get a really clear picture of what's happening with COVID-19 in the US right now. And to do that, we are going straight to the source, the CDC's own data.
So let's start with a big question, right? It's what's on a lot of our minds. And honestly, getting a straight answer can be tough. Is the virus spreading more or is it spreading less? Well, in this explainer, we're going to tackle that head on. Let's find out.
Okay, so to answer our big question, the CDC and, other health organizations, they rely on this one really crucial metric. You've probably heard this term thrown around, but let's make sure we really get it. It's called the time-varying reproductive number, or just RT for short.
Now, what's so powerful about this definition is that it's a real-time estimate. It's not looking at what happened last month or last year. It answers the question right now, today, if someone is sick, how many other people are they likely to infect? That's RT.
The easiest way to think about this is to picture a fire. The R number is basically how many new sparks each existing spark is creating. So if it's more than one, well, that fire is growing. But if it's less than one, that fire is slowly but surely going to burn itself out.
So everything, and I mean everything, hinges on the number 1. It is the absolute tipping point. If the RT is above 1, the epidemic is growing. If the RT is below 1, it's shrinking. It's that simple, but it's an incredibly powerful way to see which way the wind is blowing.
But here's the thing with any piece of data, right? You gotta know how to read it. You need to understand what it can tell us, and just as importantly, what it can't tell us to really get an accurate picture.
And this is the key takeaway, for sure. R is all about the trend. It's about the direction. Is the fire spreading faster or slower? What it does not tell you is how big the fire already is. You could have an R below 1, meaning things are getting better, but still have a huge number of people sick. So, remember, direction, not size.
All right, so now that we've got that critical piece of info down, let's get to the main event. What is the current snapshot for the entire United States? We're going to look at the very latest data published by the CDC.
So, back to our original question, is COVID-19 growing or shrinking in the US at this very moment? Well, the data gives us a pretty clear and kind of sobering answer.
34. That's the headline number. Just let that sink in for a second. According to the CDC's own models, in 34 states, that's over 2/3 of the country, the virus is currently spreading faster. That means the RT is above that critical tipping point of 1. Now, let's put that in context.
Okay, so here's the full breakdown. You see the 34 states in that growing or likely growing category. Then you've got 14 states where things are kind of stable, not really changing much. But what's really striking here is that last line, 0. As of this data, there are 0 states where infections are estimated to be on the decline, not a single one.
Okay, so we have these numbers. Big deal, right? Why does this actually matter? Well, it's a huge deal, and it all comes down to one simple idea: being prepared.
The reason RT is so incredibly important is because it's what experts call a leading indicator. Think about it. First, someone gets infected. Then, maybe days or weeks later, they might get sick enough to go to the hospital. RT tracks that very first step, the transmission, way before those other things happen.
And getting that early signal is unbelievably powerful. It's like an alarm bell that gives public health officials a crucial heads up. It warns them that hospitalizations might start rising in a few weeks. And that foresight is the difference between being proactive, getting ready, getting the public informed, and just being reactive, always playing catch up with the virus.
So what this all boils down to is that the CDC's data is giving us an early warning signal. And right now, that signal is pointing up in most of the country. Knowing which way things are heading is the essential first step. And it lets us ask the most important question of all. Now that we know this, how do we prepare?